A life-threatening disease, a controversial therapy, and the doctor at the heart of the debate. I'm Jason Farrell for N3 TV. Today we introduce you to Dr. Zannos Grekos, who is harnessing the body's power to treat heart disease.
I'm an invasive cardiologist, or that's my profession. And I also am chief medical officer for Regenocyte Clinical Centers, which is our stem cell center here in the U.S. And I'm director of cardiology for Theravite International. I had a friend who had suffered a heart attack a couple of years ago, and he wasn't doing too well with the damage to his heart. So he got in touch with me and he said, I'm thinking about going to Bangkok and having stem cells implanted. And I said to him, you're going to go where and do what? And he told me, he said that he'd run across another gentleman who had gone to Bangkok as a last resort and gotten incredible results, and that he was excited about doing this. So I got on the internet, I got on the phone, I talked to the people out in Bangkok, I talked to Theravite, I researched them, and it sounded like what they were doing was real, based on science and publications and research that had been done. He offered to take me along, and I said, sure, why not? And I went and I just had a great experience and was very, very impressed with the potential for stem cell treatment in the cardiac patients, because up until this point, as a cardiologist or any physician, we've had no ability to say to a patient, we can fix your heart, or we can repair it, or we can rejuvenate it. It's basically been, well, we can stabilize you until the inevitable happens, which is generally succumb to passing away. And we can try and improve your quality of life, but nothing that we can do to reform the damaged area of the heart. And a lot of these patients have already had bypass, or they've had stents, and they're on maximum medications, they've got defibrillators in, so they've got everything that traditional medicine to this point has been able to offer. By seeing the potential for regenerating cardiac muscle and cardiac blood vessels and perfusion, blood flow to the heart, was incredible. So I came back to the US and I pondered it, and I saw that there was a huge need for these patients that were going to Bangkok, not only to become optimized before they go over so that they can tolerate the journey and survive the travel, but also to be in the best health possible for the stem cells to take, and then when they come back, to adjust their care with regards to the stem cells. A lot of these patients would come back, the doctors that they were seeing either wouldn't want to have anything to do with them, or were just not well educated in stem cell therapy, and there isn't any right now in the US traditionally. So they wouldn't know what to do with these patients once they came back with the stem cells. So there was just a huge need for somebody to be here for them, both for before they go and then after they come back. And I think more importantly is also to educate the medical community and the patient population that is so desperately